Hello, for those on the telephone call, just in case, hopefully the system will work, but if you...
All right, Adrian, it's going.
If you...
Muted.
There we go. Good afternoon, and thank you for joining in. As I often say, and probably say too much, that this really is a dynamic and quickly evolving situation. Appreciate your commitment to providing Montanans with regular updates and top-of-the-hour news on COVID-19, and also know that all of you are working extremely hard. It's easy to get wrapped up in the numbers, and the numbers are indeed significant. Yesterday, for an example, we saw an increase of about 25% of our COVID-positive population in Montana. And while I wish it were otherwise, I certainly expect that those numbers to be increasing as some community spread occurs and as further testing is done. That's reason for real concern. It's the actions that we're taking today and actions that businesses, individuals, and each of us take today and in the immediate future that will lessen the spread in Montana. If you look at the broader map of COVID-19 cases in the U.S., Montana still does have relatively some of the lower numbers in the nation. That certainly doesn't mean we shouldn't take this seriously or that we won't see the curve go up in Montana, but I think it also highlights that with a continued focus on working together as Montanans, we have the ability to continue to both mitigate and get out in front of this. And that's exactly what we're focused on doing. Now, I have to tell you, until about a week ago, the entirety of my understanding of the term social distancing was probably limited to the notion that my teenage kids aren't always that excited about hanging out with me when they're with friends or in public places. There are concepts that we are rapidly introducing throughout this pandemic that were foreign to most of us just a week ago. So as we learn those new terms, social distancing, what does that mean? That means stay at home if you can. Don't hang out in big groups. Stay 6 feet apart from others when you can. Don't go to the grocery store every single day. Plan ahead to limit your contact with others. And recognize, well, the threat of coronavirus is greatest to those older Montanans and those that have medical conditions already. The obligation to control the spread is on each and every one of us each and every day. If you look at the positive cases to date in Montana, the average age is 46 years old. The ability to actually control the spread does rest with each and every one of us. And that also doesn't dismiss the fact that we do continue to see an increase in cases each day, and that is expected. But that also means social distancing is more important than ever. For every person who stays at home or avoids large crowds, the better our chances to fight this virus and protect our frontline healthcare workers and emergency responders. Montanans, as Montanans, we really do have an obligation to slow the spread of this virus. We're a place where neighbors talking to neighbors still matters, and our fellow Montanans can all continue to set a good example for each other in adhering to those social distancing directives and knowing that that will make a difference. Also, certainly have responsibilities as governor to ensure that we're taking the necessary measures at this time. That's why today I'll be extending the directives I've issued on school closures and on closures at dine-in restaurants, alcohol businesses, and other entities. The closures are in effect through April 10th, though they may be extended or shortened by further directive. School districts should follow the planning guidance provided in our March 19th directive to seek waivers of pupil instruction time and obtain continued state funding during this period. Well, neither of those directives expire until this Friday. I wanted to get it out for planning purposes long before. Some have asked, why don't I just close down the schools for the rest of the year? Or conversely, when I say 2 more weeks, am I confident that life will be back to normal in 2 weeks? I don't think it would be wise or serve the best interests of Montanans at this time to make decisions that will have finality for what Montana might look like 8 or 10 weeks down the road. I mean, we're daily dealing with issues and challenges, and we're learning each and every day as well. Additionally, I'm taking my recommendations on limiting social gatherings and all gatherings further. Today, we're now issuing a directive prohibiting non-essential social and recreational gatherings of individuals outside of a home or place of residence of greater than 10 people if a distance of at least 6 feet between individuals cannot be maintained. The earlier directive said discouraging all social gatherings, particularly those of a certain number. This is a bit more restrictive, and we're asking Montanans to comply. At the same time that we're extending the closures, we're also preparing for the potential of an increase of patients at our hospitals. We're doing everything we can in our capacity as a state to prepare to take care of critically ill patients, as well as if we end up getting numerous COVID-19 positive patients in our hospitals, and ensure that there's hospital space and supplies to respond. The directive that I issued yesterday allows us to transfer patients back into their home communities or into a lower level setting as they heal, which could well free up hospital or isolation beds for those that need it most. It also temporarily waives some restrictions on paperwork needed to transfer patients back into their home communities or other hospital settings. Also streamlines the state's ability to order supplies and additional space that the normal state procurement process would slow down or stall. To put it simply, it allows both the state and our hospitals to act more quickly and efficiently. We continue to explore every avenue available to bring additional supplies to our state. This past weekend and earlier this week, we're distributing a Department of Public Health and Human Services supply and the first shipment of the Strategic National Stockpile to local hospitals, EMS units, and federally qualified health centers. Over the weekend, we also received an additional 50,000 masks through a mutual aid agreement that we have with our neighbor to the east, North Dakota, which will also be shipped to all jurisdictions and tribal nations across our state. And we do expect to receive additional PPE national stockpile resources later this week. Today at the state lab, we received 4,000 additional swabs for testing. We also received additional tests. Know that in each of these areas, it's something that we're working on each and every day. The swabs is but one example, had been ordered from a private supplier, I think it was a week ago today. That order was canceled by the supplier based on demand and that the federal government needed the resources. I and some of my team had conversations with FEMA, HHS, even the Vice President's office to address the problem specifically of these supply constraints and just even centered around these swabs. And a week later that the swabs arrived. This is one of these situations that really does change day by day and even at times hour by hour. Know that we continue to work diligently here at the state, and not just at the state, but with individuals and businesses and providers in every community on this issue. But the reality really is that our supply capacity depends on either access to private suppliers, or when the private market is bottlenecked in part because of the federal government purchasing, the federal government then stepping up and honoring our requests for additional supplies. I'll continue to join the other governors in pushing for supplies and certainly won't stop fighting for Montana to receive what we need. I know that local governments are also working extremely hard to provide the services that Montanans expect during these times of closures. I'm also issuing a directive today suspending certain office hour requirements in state law to allow for limited closures where local governments can't safely operate within social distancing guidelines. The directive also allows local governments flexibility to set human resource policies that best support health-affected local government employees. I'm pleased that local governments know they can play a key role in slowing the virus and are taking these measures of trying to both contain and distance, that they're taking it seriously. Because we know that today's actions will keep the public and local government employees safe while also maintaining the local services that Montanans rely on. So thank you again. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You will be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. If you've pressed 5* and you raise your hand but have already received an answer to that question, you can lower it by also pressing 5*. So with that, questions? Go ahead.
Governor, has there been any determination made on barbershops and salons, which are common places where people congregate? A lot of people travel through.
Yeah, you know, one of the things, and with these guidelines as well that we're placing into place, it's asking businesses that are still open to practice the procedures of social distancing, limit the number of individuals in your establishment, have them 6 feet apart, and we all have to do our part. I mean, practice those precautionary and safe social distancing, but recognize also that there are common misperceptions out there that if by order a business is closed, as an example, that there's some package of relief coming to them that people otherwise wouldn't get. So already strongly recommended not going to gatherings, encouraging Montanans to take it seriously, made the decision to close venues based on conversations with public health experts and industry organizations that have requested that. If you're an individual, like if you own a barber shop, if you're not comfortable with the social distancing that we're requesting and implementing right now, then by all means, every one of us have the obligation to do our part. Someone was unmuted on the phone.
That was me, Governor Bullock. Megan Lewis with ABC Fox KFTV. At what point, what will it take for you to initiate a shelter in place for the entire state?
Yeah, and Megan, really have taken necessary and aggressive action to prevent large crowds from gathering, to stress the importance of every Montanan taking this distancing seriously. And those are the measures we've taken so far. I know that Montanans, and I sure hope that Montanans are taking the importance of this, of avoiding large crowds, only going out for walks and to the grocery store or pharmacy. I certainly hope that they're taking it serious. If it's determined that other measures are needed to be taken to limit crowd gatherings, I'll take those into consideration, certainly. And as I've said, it's a rapidly and dynamic and evolving time, but let's all of us as Montanans make sure to do our part. Mike.
What about the primary election as far as having all mail-in ballots?
Should have, we're working on it, should have something out within literally a day or so. Yes, ma'am.
So a lot of people with these, recommendations to self-quarantine have been getting outside, but just today, in Yellowstone National Park and Grand Teton, they even closed the park because they saw large numbers of visitors there. Do you plan to recommend a similar closure in Glacier National Park?
So was on the phone Sunday with both people in Park County, Gallatin County, the superintendent of the national park, the assistant secretary in charge of the whole national park system. And I think one of the challenges were 4 or 5 days ago that the Park Service said, let's go, we're waiving all fees for parks, go visit your national parks. Well, it really did cause significant challenges in our gateway communities. And that was one of the reasons why it had been requesting, as had those counties, for Yellowstone Park closure. I'm pleased that it is closed, was closed as of this morning. And I've been in conversation, had a conversation with Superintendent Mao of Glacier National Park just this morning. Someone on the phone, please.
Governor, this is Kendra Lassiter from Park County. There's been a considerable amount of discussion and debate amongst local county attorneys with respect to the enforcement of any directive that would come down from your office. Will your directives include some guidance in that regard, or?
Yeah. Gotcha. So Kendra, that the emergency declarations and the directives are health orders, and it can be enforced by a county attorney. We're making that express in these directives today.
Okay, and that was one question we had because we were looking at the statutes and it did.
Yep, we got.
Health officer.
Thank you. Yes, ma'am.
Is the testing protocol changed at all? We've gotten some messages about some people being denied testing and also showing all of their symptoms. Kind of what is being done about that?
Yeah, and going to have a discussion, I think it's later today with the hospitals, that the testing protocol has not changed, meaning that if you have symptoms and you either have traveled from an area of concern or have had exposure to someone that is COVID-19, that we are encouraging that they be tested. And recognize, though, that also means that, if someone has no symptoms, that the healthcare provider will probably say, no, I'm not going to test you at this time. And anyone that has concerns should self-quarantine. But there haven't been any directives or changes in, you still have to have a healthcare provider give you the recommendation for testing, and it's symptomatic and either from an area of concern or from close contact with somebody that is COVID-19 positive. On the phone.
Governor, it's Tom Schultz from Voices of Montana. I'm wondering if you had any initial feedback on the closures of the Canadian border, if there's any adjustments that need to be made, logistics, and also do people understand the definition of what essential traffic is? And I guess I'm speaking of it being National Ag Day, how the farmers and ranchers are adjusting.
Tom, I have not had direct discussions with anybody with the concerns of the closures, and we have been talking to the Department of Agriculture, but as issues arise, we'll certainly try to address them.
Thank you.
Yep. Someone's unmuted.
This is Bridget in Hill County. We had the question in regards to daycare closures and the directive for social distancing and why they're still open.
Why the daycares are still open?
Yes.
So, look, I think that as response to COVID-19 affects communities all across the state, certainly many Montanans continue to provide valuable and essential services, and they need access to child care. Literally, this morning I was speaking to someone who is a peace officer and his wife works at a hospital. And they right now are saying, we have nowhere for our child to go because that individual daycare had been closed. And communities know what they need to do best to respond, to keep our communities safe while also providing essential services within the community. Allowing daycares to stay open if they're able and want to is a good solution for Montana communities, certainly to support those first responders and healthcare providers. But there's also, and more than just that, I mean, folks that work in grocery stores or delivery or adult and child protective services, pharmacy workers, others. We're recommending that providers who choose to continue to provide daycare services follow the CDC guidelines for social distancing and proper sanitary and hygiene practices for their safety and that of the children in the care. Other questions? Yes, ma'am.
I have a question. So, a lot of people raised concerns this weekend after becoming unemployed and trying to apply on the website, and it really just couldn't handle the traffic and crashed. And a lot of people said even not online over the phone, they struggled to even just apply, let alone actually see that money. What's your office doing to handle that?
Yeah, and recognizing that and look, we have seen a significant increase in both new claims and claim reactivation. Since March 16th, I think we've received approximately 15,000 claims. And when we put this out also, we said, recognize that the straits, we suspended the week waiting period and we'll get up and running as soon as we can and be patient. So hopefully we've taken care of all the IT side of this and we'll continue to try to provide the resources that Montanans need. Somebody on the phone?
Is that me?
I think it is.
Oh, hi. This is Nikki Willette from Yellowstone Public Radio. I'm curious. Yesterday, President Trump, during a press conference, said that things should go back to normal. What do you make of that?
Well, I think the public health and economic issues should drive it. I mean, look, I have been concerned at times that the president's comments and tweets far too often appear that he's viewing this as a political challenge. And I think almost every governor across this country are viewing it as a public health challenge, an economic challenge, and through the lens of how it impacts individuals and communities that we serve, not how it impacts us individually. I mean, I'm going to continue to have our state restrictions, and that's why I do it at a 2-week period, saying though that would love it at some point if it wasn't even to the duration of the 2 weeks, but we'll continue to try to view it through the lens of public health, economic, and how it's impacting people in communities and individuals all across our state. Other questions?
Governor Bullock,
Go ahead.
this is Kathy Maloney, County Superintendent for Butte Silver Bow. We are encouraging school boards to meet to get waivers for emergency declarations. How do we handle those?
Kathy, I'd talk to your local school board. I mean, that's...
Yes, but does the county superintendent have a role that we need to get this to you?
We'd be happy to give you a call offline.
Okay, thank you.
Thank you. Other questions? Someone's live.
Governor, this is Casey Elliott with the Bill and Tribune. Are you defining what is specifically an essential service?
I'm sorry, I didn't understand. Try saying that one more time.
Are you specifically defining an essential service at this time?
We're not. So the question was, are you specifically defining, like we've received any number of letters from businesses and others saying that if there is a shelter in place and close down of non-essential businesses, please count me as an essential business. We have not done that because we also haven't made closures to every business deemed quote unquote non-essential. Is there someone else online, on the phone, is unmuted?
Hey, are you hearing me?
I sure am.
Awesome. So, we've seen, courts give directives to release, at the county jail level some, nonviolent offenders. I'm wondering if you're looking at anything with the state prison. I know they've had a test there that came back negative, but just some of the risks of the population there being in such a confined space, if there's anything you're considering looking at that.
Yeah, Holly, yeah, the Chief Justice of the Supreme Court put out a directive yesterday. I mean, we've been having meetings with correction officials and others even today, but nothing today to announce for sure.
And wondering if you're looking at, anything with state employees. I've gotten some people who are still working in offices reaching out to me saying they're concerned and don't really know what might be happening. Are you looking at, we did see public health offices around, assistance offices and others around the state shuttered within PPHHS, but anything statewide that you're looking at there?
Yeah, on Monday morning, we put out a guide toward teleworking, and it's being actually delivered and implemented agency by agency. And we can get you a copy if you didn't see, though I'm imagine you saw what we put out.
Okay, thank you.
Yep.
Media broadcast.
Please go ahead.
I was wondering if you received any assistance or directives from FEMA or any other government organizations offering help or PPE, anything like that.
If we've received any what directives or help?
Either from FEMA specifically or any other government organizations.
Yes, I mean, we've received everything from 50,000 masks from North Dakota to working with FEMA when it comes to I or us making supply requests. We've worked with Health and Human Services. We've worked with CDC, so we're working with all of our federal partners. Last question. On the phone.
Sure, Eric Dees, Montana Free Press here. The federal bill that's working its way through Congress, what are you hoping to see in that?
Yeah, and Eric, I guess I'm not sure where the federal bill is right now and what all is included in it. I mean, it's on behalf of all of our governors, Democrats and Republicans. We had sent a letter to leadership last week with some specific requests, which would include things like the amount of dollars that would be going, at least $150 billion in immediate direct aid to the states with maximum flexibility for that, an increase in FMAP. Had also sent a letter to our delegation, I think it was Saturday, both expressing some of those issues as well as block grants to small businesses that I know that we're having many of our businesses go through the Small Business Administration, but there are also programs at the state level that I think that we could actually probably get that money out that much easier. We've expressed concerns that as you look at sometimes a one-size-fits-all stimulus or relief program, it doesn't always address some of the unique challenges and sovereignty of our tribal nations. So to ensure that that's viewed as well as a couple of other areas. But I'm not sure candidly what the status of the federal bill is right now. And I know that, I mean, we had a call, we collectively, the governors of the states and territories yesterday with the vice president and other federal officials and expressed some of our, from our perspective, sort of the unified points of what we would like to see in that bill.
Great. Thank you.
Great, thank you. Thank you again, and maybe providing, we'll see, maybe even as soon as tomorrow, another update. Thanks so much.